We are back with another round of pregnancy-safe movements for you guys. This time it's all about lower body, so I'm gonna let Ray take it away and just talk to you about what we're doing today.
Your lower body is going to be really important to focus on during pregnancy because your lower body is going to support your spine, it's going to support your pelvis, and it's going to help us keep that proper alignment that's going to be really important throughout your pregnancy. A strong lower body is also specifically going to look at some strong glutes. So having strong glutes is going to keep your pelvis aligned, which is going to make more room for your baby to grow and stay in a proper position, making labor even smoother for you when you get there. And also, who doesn't like to just have a nice butt, no matter where they're at in their life, especially during their pregnancy. So we're gonna show you some lower body movements that you can do from first trimester all the way through to your third trimester. Okay, so this is going to be a reverse lunge. We love a reverse lunge because it's also going to focus on single leg stability, because when you take that step back, for a moment there, you're really balancing on one leg. So Monique is going to take a long step back with one of her legs, doesn't really matter which one she starts with. She's gonna bring her knee down to the ground nice and smooth, and then step back into where she started. And when she does that again, she's gonna take that step back. You can notice how her knee is gonna stay in line with her ankle. Good, it's not gonna push out over her toe. Give me some like smooth repetitive ones. Good, she's really pushing off of this leg's glute, getting that glute nice and strong. It doesn't matter too much if she wants to hinge a little bit forward, so you can show them that option with her torso. But as your belly grows, it might be more comfortable for you to just stay nice and upright. What's gonna be really important here, if you decide to do this with weights, is that you don't let your shoulders internally rotate. So always keeping that nice, good posture all down through your spine. We are gonna do a goblet squat now. So we do goblet squats with Monique, we do barbell back squats. If working with the barbell is something that you are comfortable with, that is absolutely fine to do during your pregnancy. But today, for our goblet squat, we are going to have Monique with this 20-pound dumbbell. It is gonna be vertically up and down, and the heels of her hands are gonna be holding on there, so it looks kind of like a goblet. Her feet are gonna be just slightly wider than her hips, and her toes are turned out just slightly. She's gonna take a big inhale with her ribs in neutral and her pelvis in neutral. Then she's gonna break at her hips, set her hips back nice and deep. Good, pushing her knees out over her toes and then pushing through her heels to stand on up. Good, push those knees out nice and wide. Good, and up. So if you have limited mobility here, feel free to sort of elevate your heels, maybe with some plates that you have at your gym, maybe with some small books that you have at home if you're doing this at home. She's inhaling at the top and then exhaling to come up, so she's really supporting her core the whole time. Boom. Boom, boom. This is our kettlebell deadlift. You can do this with a kettlebell if you're comfortable performing this with a barbell. Monique can actually do this with like 115 pounds, even with baby coming along for the ride. But today we're gonna use the kettlebell. So to get into her deadlift position, she is going to hinge at her hips, so bring her hips back, and then she's gonna bend her knees. She's gonna bring the kettlebell right down in between her shoelaces. For her deadlift, she wants to feel her hamstrings and her glutes working, so she's gonna bring her butt to live somewhere between her shoulders and her knees here. Her chest is gonna be up. She's gonna take that inhale. She's gonna drive through her heels, stand all the way up. Good, make sure her ribs stay in, her glutes stay tight. And then she's gonna bring her hips back down to that starting position. Good, inhale, and exhale to drive up. Good, so this is really good for keeping her spine in line and really like keeping her total body strong here, from her shoulders all the way down to her feet. So this is our staggered RDL. So again, a split stance position, working with a little bit more balance. Front foot forward, back leg back, and she's gonna be up on her tippy toe back there, keeping her back nice and flat. She's gonna hinge at her hips and bring that kettlebell down towards her ankle. Good, nice flat back, and then she's gonna pull her hips forward to stand up. Good, so lots of glute work here, and also a lot of core stability to keep this side from slumping down and sagging. Good, hopefully you can hear her breathing, inhaling as she prepares. Hips go back, she's keeping that core nice and tight, and then she's exhaling as she pulls up. So this is our mini band lateral walk. Mini band lateral walks are really great for strengthening specifically your glute med, which is great for stabilizing your pelvis. So Monique's gonna bend her knees a little bit and come into that hip hinge, keeping tension on that band and pushing her knees out wide, a little bit wider. Yeah, she's gonna take a couple steps to her right. Good, always keeping tension in that band and staying nice and low. And then she's gonna take some steps back to the left. So there's always tension in that band. She's keeping her glutes working. For these guys, you might wanna do something with a good amount of resistance. You can really feel your glutes working right from that very first rep. Always keeping her spine nice and neutral, so no excessive arch up or over. Okay, so now we are going to do a glute bridge. So we're gonna do this with a miniband just to make it a little bit more difficult. You are absolutely free to do this without a miniband. We're gonna have that miniband up around her knees, and then she's gonna push her knees out to really activate her glutes. And then driving down through her heels, she's gonna press her hips up, keeping her ribs in neutral and her pelvis in neutral, so no excessive arch. She's gonna give her glutes a big squeeze at the top, and then bring that back down. And then she's gonna drive her ribs in together. Inhale, good. Exhale and press up, good, and back down. So inhale to prepare, exhale, press those glutes up, give them a big squeeze at the top, good. So we don't want to go into hyperextension with that back where you have a giant arch in your back. Keeping your lumbar spine, that lower part of your back, with that just that neutral, natural little arch is totally fine, especially during pregnancy. You just want to be conscious of keeping your ribs and your hips in that neutral position.